we now have a fireside chat. This is an interesting chat which is going to be covering this intervention between pain and neuroscience. And for this chat, we have Professor Alan Harvey. Professor Alan Harvey is a neuroscientist from the University of Western Australia, and he's here to share some insights from his fascinating research on pain perception and music as an intervention and discuss this with our moderator for today, Professor Rashmi Gupta. Professor Rashmi Gupta is a cognitive scientist from IIT Bombay, and her work has been extensively used in mediation and emotions. So, over to Rashmi for moderating our session. Thank you all for joining, and please settle down a little so we can start this session. Thank you.
Good evening to all of you. Welcome to the session titled Unseen Agony Exploring Pain, Perception, and Music's Healing Harmony. And this is called Fireside Chat, and we can feel the fire, yeah? It's so hot today. Okay, great. So we do have Professor Alan Harvey with us, and he's the emeritus professor at University of Western Australia. So if you know this topic, we are going to talk about a lot today, pain, okay? And if you look at the title of this panel, I think we have to define, few concepts. But before going into this hot topic, I would like to tell that there was another speaker here, Dr. Shushma Bhatnagar, and he was also one of the panelists for this session, but unfortunately she was not able to join us. So Professor Allen, you and me both have to...
So that's the definition of pain.
Yeah.
8 o'clock last night, I discovered I was doing this on my own. So there is one definition of pain. We'll go on for some more.
Yeah, so you can see this live example of pain, right? So we both have to take this pain and just let's dive in and start this session. So yeah, Professor Allen, I would like to start with this beautiful concept of pain. And in the faculty lounge, we were discussing a lot about this. And I personally think that pain is so important in our life. And I have this theory, but I'm not sure whether this is true or not, that if we do not feel pain, maybe we will be less empathetic. So I'm not sure whether, is there any scientific evidence to see the relationship between these two, or somebody already tested this. But yeah, I will directly go to Professor Allen, and I would like to request him if he can tell us what is actually pain, how to define pain.
So there, hey, there is a definition. That's quite loud. The Institute Association of Pain have a definition, which is this: pain can range widely in intensity, quality, and duration, and has diverse pathophysiological mechanisms. It's an unpleasant sensory and emotional experience, right, associated with or resembling that associated with actual or potential tissue damage. So feeling pain does not necessarily relate to actual tissue damage at all. In fact, before we begin, we were discussing why pain is important. And of course, if you don't feel pain, you've got various issues. And pain is so that you run away from aversive events, so that you escape from noxious stimuli, to protect your own self, obviously. And we were discussing this, and there was a young woman in the green room who overheard us and said, "I don't feel pain." Now, that's weird, because I'd never met anyone who had no perception of pain, and she was standing right next to us. She once had a surfing accident and busted her brachial plexus, and only noticed that it was damaged because she saw bruising on the surface of the skin. Really, it's just extraordinary. But pain is complicated, and it's complicated because it is not just a physical thing, it's a cognitive and psychological thing as well. So what I tried to do in my recent deep dive, if you like, into why music seems to reduce pain, I discovered actually it's a very complicated area, because pain is so complicated, and there are many different types of pain. So there's acute pain, when you jab yourself with a scissors or do something dumb and kick your toe on a statue or something. But there's also what's called neuropathic pain, which clinicians don't really understand. They can be shooting or burning pain, stabbing experiences, and they're not necessarily associated with any physical impact upon the body. There's also a thing called visceral pain. So that's something that happens in your viscera. So if you are having a heart attack, and please don't do that, the pain is transferred to the jaw and the left shoulder and the left arm. So where the pain is experienced on the body surface is not necessarily where the object of where the damage is occurring. And there's also various other pains that are associated with the psychology and the remembrance of pain. Things can become painful even if the stimulus is not actually a noxious stimulus. So it's a very, very complex and difficult topic, and we'll try and see if we can get some understanding of how music might interface and reduce our perception of pain or our experience of pain in a way that's positive for both mental health and physical health.
So thank you so much, Professor Allen, for defining what is pain. So I'm just wondering that how would you define the concept of unseen agony in the context of pain and perception? So why unseen agony? Why we say unseen?
How many of you, if you're in pain, let somebody else know that you're in pain? I bet it's mostly men. Does that sound odd? My wife sometimes has migraines, and I always get shocked that she's had one because she doesn't seem to change her behavior very much. So that's an unseen agony. And it's not because I'm married, incidentally. That's a whole different thing altogether. So it's a manifestation, it's a psychological experience that is often expressed in grimacing or crying or some change in your posture or whatever it might be. But no one else can really tell you what the intensity or the affective nature or emotional nature of that pain you're experiencing is. And it's very context dependent. So without going into the realms of dodginess, some people actually quite like pain under some circumstances, and they go looking for it, which is weird for most people. So it depends on context, it depends on circumstance, how you actually perceive that pain and the extent to which it impacts upon your emotional sense of well-being.
Well, I hate pain because sometimes I am having headache and it's kind of a throbbing sensation, I would say. Then I am like, I just can't concentrate. And kudos to his wife, like she can, hide and, still can work and, live her life. But when I'm having headache, I just cannot concentrate. And you can see my face, and I'm just all the time irritated and just cannot do anything. So I think this unseen agony doesn't work, at least on me.
I'll take your word for it.
Okay. So now we understood a little bit about the overview or some introduction about the pain. Let's move on the second very important concept about the music's healing harmony. So the healing power of music, okay? So in your opinion, Dr. Harvey, how does music interact with the human experience of pain, both physically and emotionally?
Okay, that's a huge question. There is absolutely no doubt at all that that music therapy can reduce our experience of pain. And there are numerous examples of this in the clinical literature. The question is, how does it work? And it's probably working in very many different ways. So in the clinical context, it's been shown to have an impact on, for example, burns, the experience of people with burns. It has an effect on surgery, pre- and post-operative surgery. It has an effect on diverse things like orthopedics, laparoscopies, and on all sorts of different kind of clinical practices. The issue then is, how does it work and why does it work? So there's now a lot of experimentation where they take healthy subjects and expose them to acute pain. It may be thermal pain, that might be very cold or very hot, or pressure, where pressure is forced onto the surface of a skin. And they then measure and play music to those individuals and ask them about whether things was it painful? Did you feel less anxious about the pain? Was the experience of that pain different? Was it less intense? And so on and so forth. So there are now many, many, many studies that have been doing this around the world. There are a couple of problems with this in relating this to how this might affect in the clinic in terms of the use of music in the clinical context. Because, for one thing, if you were to go, how many of you would be willing to go to a pain trial? Not many. Oh, there's 1, 2, 3, 4, 5, 6. What about, how many would prefer not to go to a pain trial? Yeah, okay. So the problem there is that a lot of people don't want to do that. So when you're doing a trial on the effect of music in acute pain, you're actually working on a very selective population of people who don't really care whether it's painful or not. They don't have a negative expectancy, this is going to be horrid. So you're not dealing with, a completely random population. And the other problem is, of course, that while music seems to have this beneficial effect in many acute pain situations, it's much more complicated in the way we want to use it to treat chronic pain. Because chronic pain is a very ill-defined and difficult subject. When you talk to pain clinicians, they really haven't got a handle on how to treat chronic pain over a long period of time. The use of opiates, which are these drugs to reduce pain. By the way, I might just explain what opiates are. So it's a very interesting story in pharmacology, because for centuries people have been taking opium or heroin or any of these opiate-type drugs for pain relief, but also to have interesting experiences, can I put it that way? And some people said, well, hang on just a minute. If there's all these sort of chemicals that we're putting into our body affecting the pain relief and our perception, surely there's got to be receptors in our body for those chemicals. So if there are receptors in the body for those chemicals, there must be equivalent chemicals that we make ourselves, right? Does that make sense? And those are what are called endorphins or enkephalins. So they're the intrinsic opioid small peptides, small amino acids that are bind to us these things called opioid receptors. And they're the sort of things that you get, anyone who runs a marathon or does a lot of running gets this thing called a runner's high, which is the release of endorphins, and you get this kind of sort of non-painful, slightly outer world experience of doing that exercise. So there is a lot of work being done in chronic pain on using opiates, but the problem with opiates is that people become addicted to them. And in fact, if you become addicted to them, eventually opiates can make pain even worse. It kind of flips into the opposite direction. So people who require more and more opiates are actually experiencing higher levels of pain. If you play music, so this means that you've got to try and find alternative ways of treating chronic pain. And there are probably people out here who have chronic pain, and it gets more obvious as you get older. And there is paracetamol, there are various non-steroidal anti-inflammatories and so on. Music, there are people who claim that music will have a positive impact on chronic pain. How that works is very complicated, because one of the problems is that people who have chronic pain, you can actually monitor changes in their brain associated with that chronic pain experience. You can measure changes in the architecture of the brain in people who are suffering from chronic pain. So when you do trials on pain and music with acute pain, it's a little bit of a jump to then understand if that really works in the chronic pain situation. In terms of endorphins, if people are singing together or dancing together, You can measure, people have measured, so a group in Oxford has measured that their sensitivity to pain after singing in a group or after dancing in a group, their sensitivity is reduced. So they feel less pain when it's tested. And that's really one of the major sort of trials that says that this thing works. They interpret that as the release of endorphins, but if we have time, I'll suggest that perhaps the other things are at play.
So, Dr. Alan, you since brought this topic of chronic pain, I was just wondering what is the relationship between acute and chronic pain? Is there any relationship between acute and chronic pain, or
As I said, acute pain is generally related to a physical event, a noxious event. It might be heat, it might be a burn, it could be extreme cold, it could be jabbing yourself with a needle, it could be tearing a anterior ligament in the knee or pulling a hamstring when you're running to stop a four. When I actually did that playing cricket, I pulled a hamstring and got run out on 49, which was a real shame. Anyway, that's another story. So these things are normally associated with acute noxious stimuli where there is a particular set of receptors and fibers that go from the skin surface or from the muscle or whatever, taking those particular painful or temperature-sensitive triggers into the spinal cord or into the brain and then processed in multiple areas in the brain. There is no specific area in our brains that can be shown to be that region that responds to pain. There isn't one. It's a diverse sort of network all over the place. When you image people who are in pain, all sorts of different parts of the nervous system are lighting up. So it's a very diffuse
complex network.
Some of it relates to the sensory perception of the pain, but sometimes it reflects your own cognitive experience and how that affects the way you're appreciating that horrible experience, which is the painful experience. Chronic pain, as I said earlier, can be an ongoing thing with no immediate noxious problem at all, and a lot of it can do with the fact, so for example, if you have a joint that's a problem and you have a lot of inflammation, there's no direct noxious stimulation going on for those fibers, but the inflammation is actually that's associated with that injury is activating a whole bunch of signals that are interpreted as painful signals. And that's how the brain then looks at it, and it feels this ongoing ache or this ongoing, nasty feeling of chronic pain. But there's no obvious drivers of those fibers. It's just the inflammatory changes and the various other changes that are stimulating other parts of the system.
So, Dr. Alan, I'm just wondering that, do you think some people are more sensitive towards pain?
Yeah.
And if yes, then is there any cognitive mechanism or psychological variables that affect this?
It's clear that some people are more sensitive to pain than others, and that may be related to when they actually go and look at the number of the opioid receptors that a person has. Different people have different levels. So some people have more receptors than others, and you would think that the people who have more receptors are perhaps more likely to be less sensitive to pain than those that have less receptors because they've got less endogenous expression of those opioids to suppress pain. So yes, there is variability, but there are other variables. So if you have a negative expectancy, a negative mindset that something, as most of you guys don't want to do a pain trial because you think it's not going to be very nice. Those that put their hand up and said, oh, I'll do it, probably have a very positive outlook in life and probably need the money anyway. So that's a very different thing altogether. But also your experience. So if as a young person you've experienced pain, physical pain, that can have a prolonged impact on how you then appreciate that pain and the anxiety that's associated with pain.
Very interesting. Move on. Yeah. So let's go into more scientific insights related to how music affects, pain perception. So, Professor Harvey, from a neuroscientific standpoint, how does the brain process pain and respond to musical stimuli?
So the areas of the brain that are active during painful activation of pain, there's a significant overlap with areas of the brain that are involved in processing of either in these opioids or another peptide called oxytocin. So one of the reasons I decided to get into this, to discuss this, is because this other peptide called oxytocin is also reduces pain. And oxytocin is released during communal music making and communal dancing. So I think oxytocin is a key player in the reason why music actually acts not only in the periphery, at the level of the spinal cord, at the level of the brainstem, and also in the forebrain as well. It has actions throughout those different regions. And it also, interestingly enough, combines with the endorphins and can bind onto the receptor of some of those receptors to actively stimulate and activate endorphin responses even more. So these two systems sort of work together. And I just want to say, we did talk about this before, but I've got this theory, now, so bear with me on this one. Now this is probably, when mums are giving birth, I think you should be listening to music that you really like. By the way, when they do surgery, the key element in whether music works or not to reduce pain is that someone shouldn't tell you what you should listen to. The patient needs to choose their own music. It needs to be calming, it needs to be relaxing, and it needs to be something that is meaningful to you. It's absolutely clear. So I don't know why when women are giving birth, they're not asked to have their favourite calming music being played during the whole process, because there'll be even more oxytocin being released during that process. Now, everyone perhaps knows that during childbirth, there's a big spike in release of this peptide that's needed for the uterine contraction for the baby to come out, but also to produce milk.
Yeah.
The fact is that oxytocin has two very interesting things that it does as well, or three. The first thing is that it's involved in attachment between the mum and the baby. That's really important. The second thing is, because it reduces pain sensitivity, it may mean that giving birth to a child is not quite as painful as it might otherwise have been. And I know that might be hard to believe, but that's maybe possible. The other thing about oxytocin, which is really interesting, is it's being used to reduce the memory of adverse events, post-traumatic stress disorder. Now, my understanding is that giving birth is not always the most pleasant thing. So maybe, and I'm throwing this out there for you guys, maybe playing nice music during childbirth not only increases oxytocin, but it's maybe the reason why women forget that childbirth was so horrible that they're willing to have another child. Just put that out there and see what you think.
Yeah, so as I was discussing with you earlier, that when I was giving birth to my baby, and of course it's not a very pleasant experience, it's very painful. And then after this, delivering her, doctor was stitching, and I just asked, why you are taking so much time? Then he said that I am just doing it very carefully, that when you give birth to your next child, it should heal quite well. So I'm just taking so much time to stitch quite so well. When he talks about the second child, I was so angry. I just wanted to slap him. I was like, I'm just going through so pain, and he's talking about giving birth to the second child. But yeah, now I can relate, what you said, that I just forgot all those pain, and I can, enjoy. Now I can now see that, it was a beautiful experience. So you see that how it was so negative in the beginning, but now everything converted into so positive emotions. So yes, I quite agree with you that, the way we consolidated earlier, and then now we reactivated that negative memory, and somehow, when you feed your baby, and then there's a release of oxytocin, so you get this attachment. And then maybe when you reactivate your memory, then there is a reconsolidation phase goes on. And then maybe this release of oxytocin just remove this negative part from that memory. So Yeah?
we can see.
Yeah.
But I think one of the important things about appreciating or getting clinicians, and this is always the problem, that it's a pity that the clinician wasn't here with us, because many of them have very fixed views about what is medicine and what isn't proper medicine. So they're these sort of alternative therapy ideas. And for a long, long time, music therapy was thought to be the same thing as drinking green tea or iridology or some sort of alternative practice that didn't have any scientific substance. But we now know that there is this scientific substance, and I talked a bit about that yesterday morning. So music therapy is now, I think, becoming more and more accepted, not just for itself, but as a way of adding synergistically with other ongoing treatments for pain. And when I wrote this review with a couple of clinicians, their big aim in life really is to try and find ways of reducing acute and chronic pain, post-surgical pain, without having to use opiates. Because as I said earlier, opiate addiction is a real problem. And there's been several studies now showing that if people going into surgery, if they choose the music, as I said earlier, that they really like and that really is peaceful for them, that when they come out the other side, there's a reduced need for opiates to be used. So the concentration of drugs that they need for pain relief after the surgery is less if they've had music therapy as part of the regime, either before or during or just after their surgical procedure. There's several studies now showing this reduced dependency. And the other thing that's really key here is that a lot of people that come out of surgery are very anxious, incredibly anxious. And the music therapy reduces that anxiety. And so it means that anxiety can actually interfere with healing and with going onwards. So this effect of music on reducing the sense of being anxious afterwards and having negative expectations, that's also a good thing in terms of post-surgical treatment. It really does work.
So let's move to a little bit personal experiences and stories. Are there any specific instances or patient stories that stand out in your career, highlighting the profound effects of music in mitigating pain and improving the overall quality of life? Have you, any patient,
Well, I'm not a clinician, so all I can say is that I don't think I'd be here now if I didn't have music every day of my life. How many people listen to music every day? Yeah, look at this. See why? Because it's good for you.
Yeah.
But I should add that it isn't just the physiological effects that it has in terms of things like pain and so on. It's the enormous benefit it has on mental health. And so I'm lucky enough to sing in a couple of the state symphony choir, for example, and another big choir, and being in that choral context, in a group context, is quite wonderful. You really get to know and trust those other people. And one of the things that I have concern about, actually, just as an aside, is so many young people are now just spending their time with headphones on their own or in isolated contexts looking at computers. And there's much reduction in communal music making or communal acts of movement and dance. And I do think that's a problem, because I do think that the whole reason music exists is to drive pro-social communal behaviour and to enhance mental health through that. And as well as all these impacts that it has on the physiology and pain relief, these other, if you like, higher level mental attributes will also contribute to how you respond to an adverse event. So if you're in a good mental state and in good mental health and with a good community around you, you're going to respond better to these adverse events, which may include painful events, much better than if you're alone and feel vulnerable and have a negative expectancy. That seems self-evident to me.
Yeah, very interesting. So, Dr. Allen, I think let's talk about last one, about the challenges and opportunities. So, I know that we do not have Dr. Bhatnagar with us, but if you can give some insight, like what challenges do we face in integrating music therapy into mainstream healthcare practices, particularly in addressing unseen agony? Do you think it's very easy to incorporate this music therapy in day-to-day intervention
It's
technique?
happening,
Okay.
but
Yeah.
again, as I said, I think intimated earlier, it may be different in different cultures, in different countries. I can't talk about that.
Yeah.
But trying to persuade a traditional clinician who's been using pharmacotherapies and various other classic treatments to treat pain, that somehow you can play a nice soothing piece of music to the patient and it'll make a difference. You, I've talked to people and they'll say, no, can't possibly work. But then there are others who are more open to it. So I just think that the more people are aware of the healing power and the anti-nociceptive or the pain-reducing power of music, especially, again, if the patient makes their own judgment and makes their call, the more people who are willing to go to their clinicians and say, can we add this into my therapeutic regime because I can present you with some evidence that it works, that will gradually happen, and maybe it'll become a much more common practice in operating theatres and in clinics.
Okay. I think this is very fascinating, I would say. So definitely, this is the last question probably I will ask you, because this is related to the takeaways for the general public. So what practical steps or advice would you offer to individuals seeking to incorporate music into their lives for health and wellness purposes?
3 words: just do it.
Yeah. Very interesting. So thank you so much, Dr. Ellen, for this wonderful insight to see the interaction between pain, perception, and music. So shall we move to audience?
Yes, thank you so much, Professor Allen. This was an amazing chat, and I'm sure you all are buzzing with questions. So we'll do a little 15 minutes Q&A round. Please ask your questions to Professor Allen and Rashmi.
Hi, Professor. It was a wonderful session.
Thank you.
I would like to ask one question. So, do you think that singers and musicians would be able to go through pain in a better way, as they are always listening to music and probably having a high level of oxytocin as compared to people from other field?
Right. Okay. So it's a good question. I've been lucky enough to work with a professional cellist. I'm supervising a student who's working on whether, if you do a performance and you have a negative expectation of how well you're going to do, does that mean you think you did well or badly afterwards? And it's sort of an interesting concept of sort of how, whether you have a positive or negative mindset about performing. But she tells me that she thinks almost the vast majority of professional musicians are in pain all the time because of musculoskeletal pain of some kind of another, thumbs or lips or wherever, whatever, depending on the instrument. If you're playing saxophones or oboes, there's shoulder pain, there's all sorts of things. And most of them actually are playing through some pain. So in answer to your question, there is a lot of pain in professional music making, which I didn't realise. And maybe the fact that... well, there is one other thing I should say. In orchestral musicians, my impression is that they sit in front of their dots or their music, and I'm talking now about Western art music, so my apologies for those of you who are experienced in Indian music. But I think they're primarily just following the notes, and not that as long as they're in time with everything else, they're really thinking along their own channel. And that isn't really communal music making. I know they're an orchestra, but they're really individuals following their own musical score. And an interesting corollary of that is that there was a really interesting study that I hang one of my hats on, where they took a group of singers and got them to read a score and sing together, and they measured the levels of oxytocin in the plasma of those singers. And then they took the same singers and said, okay, go away and go and improvise and make something up. Not with no score, nothing. Just make something up. A bit like what jazz musicians do. Someone needs to incidentally measure oxytocin in jazz musicians, because I bet it's higher than orchestral musicians, but I'm just throwing that out there. But they then looked at the oxytocin levels in those musicians those singers who are improvising, and they went up, significantly up. Because the whole point of improvisation is you have to listen so carefully to everybody else so that it all makes sense, right? You're not just following your own score channel. If you've got 8 people and they're trying to create some sensible sound that they're improvising, you have to listen, the whole group has to be listening to everybody else to make it work. And that's when that communal pro-social drive is at its highest. So does that sort of answer your question? Yeah, okay.
Any more questions do we have? Yeah, can someone
Yes,
please? Yeah.
Where are you?
I had a question. Why do people cancel out pain with pain?
Now that's a very interesting thing. Thank you for that. There's this thing called DNIC, and it's thought to be related to certain cells in the spinal cord that receive input from a range of different body locations. So if you have one pain in one part of the body, if you activate and present pain in another part of the body, it seems to negate the input from the initial stimulus. And it involves both things at the level of the spinal cord, and there's some suggestion, there's some feed down from the brainstem back down the spinal cord as well that seems to be involved in that. And there's several studies suggesting that music can interfere with that process or boost that process. And at the moment, from my reading of the literature, there's no clear indication which way that's going to fall. But certainly it's an interesting phenomenon. There's another thing called the temporal summation of pain, where if you have a painful stimulus and then you do another painful stimulus, it's even more painful than the first one, because it summates and adds up, so the signal gets boosted the second time around. And again, there's some suggestion that some experiments suggesting that music can stop that summation of pain if you're constantly being hit with the same noxious stimulus, that music can sort of prevent that from building and continuing to rise. Good question, thank you.
Very interesting. So we do have time only for 2 more questions. Yeah, please.
Yes, somebody,
hello.
where are you?
Hello.
Yeah, hi.
Yeah, the session was great. I just wanted to ask you about, from the public health perspective, how would music therapy be applicable, for a large scale, on large scale, especially in India, where the government facilities for patient is a lot more widespread. So how applicable do you think it is at this current stage?
Yeah, I can't answer for you, for this country, but in most surgical wards in Australia, for example, there would be really no reason why they couldn't introduce it at all for anybody who wanted it, because there are different ways that you can introduce music into the system. And there's some complexity to this. Some people use headphones. Some people have music played through the pillow so that there's nothing impinging directly on the headphones. Some people, as I say, choose their own. Sometimes they have a music therapy program to help it. So there's a lot of variability in there. But I don't see any barriers in terms of, given that all of you listen to music all the time, what's to stop you just saying, I want some. But we don't yet know how long. Is 30 minutes enough? Is 60 minutes enough? Is 2 hours enough? Should we do it 3 days before the surgery or immediately before? There's all these variables that still haven't really been ironed out. But the more work that's being done, I think the clearer the optimal kind of situation will be developed. But we just need to keep pushing it, because I think it's a very powerful adjunct to normal other clinical practice.
The best take-home message is just do it. Even just listen for a minute. You just start it. Yeah?
I'm not sure a minute's enough, but it's okay. And heavy metal music I'm not sure about, but I have a problem with that anyway.
So, just last question, if someone has, that's it. Yeah, please, here, maybe.
Hello.
Hello, where are you?
Okay, the question is coming from the young
hello.
mind.
Oh, hello.
Yeah.
Okay.
Hi, sir. You mentioned about surgery and all, but I had this question: can music be used to heal the conditions which are happening due to hormonal imbalances like PCOS, PCOD, thyroid, because it's very common nowadays and girls are suffering a lot because of it. And the second question is, you mentioned that there are insensitive sensitive people, there are high number of receptors. So is there a condition where we have a person has extremely low receptors, and is it dangerous?
Well, as I said, we
we
met
met.
some we met somebody in just here who has no sensation of pain at all. So as I said, she had a brachial injury and didn't notice until she saw the bruising. She had a big cyst on her that she told us about that got so bad that it would have killed her.
And she fainted, and then only
She
realized.
fainted but didn't know it was painful. And
Yeah.
they only discovered it because she fainted because of the toxins that were going into her body. So not responding to pain is a catastrophe. It's very, very dangerous. In terms of the other thing, yes, music's being used in things like spectrum disorders, in autism, it's being used in dysphasia, it's being used in Alzheimer's disease, Parkinson's disease, ADHD. There's now some evidence that's useful in ADHD. And because it has such a profound effect on hormonal systems and endocrine systems, and it even has been shown to change heart rate, blood pressure, in all those things, I think we've only yet scratched the surface, not me, but the people who are getting into this, about its diverse potential in not just anti-pain kind of therapies, but in generally enhancing the immune health and the cardiovascular health of everybody. And if you exercise at the same time, then you're giving yourself a really good option for good mental and physical health. So when I give talks to older people in Perth about healthy aging, my tip always is, if you're physically capable, get out and into a community, sing or dance. And I used to actually play in a rock and roll band that played Creedence Clearwater and Elvis and Beatles and stuff. And we'd have 300 people dancing for 3 hours to their favourite music. And they'd go home happy as anything, not realising they'd just done 3 hours of exercise because they were just dancing. So whatever music rocks your boat, get out and do it.
Yeah. So, well, thank you, Professor Harvey, for a wonderful insight to explain beautifully how pain, perception, and music, all three interact with each other. And just a 2 cents from my side, I would like to add here, because I belong to the cognitive science field. And if you have attended my talk in the morning, so there was a video I have shown, and you may have seen that just mere exposure of money can enhance your pain tolerance, right? If you remember that. Yeah, mere exposure of money. So I'm just trying to find the link. So there might be possibility that when we listen music, maybe it activates somehow your reward pathway. So similarly, when you see money or when you are exposed to money, it may activate your reward pathway. And money means power, power means more physical strength, right? We have seen this already in that video. So there might be possibility that these mechanisms are like shared, when we process money, when we listen music, it all activates a reward pathway, and somehow it enhances your pain tolerance.
So
right?
that means rock and roll musicians feel no pain.
Yeah.
Right? Because they're rich
Yeah.
and they're popular. And do they think that works? Probably it works.
Yeah, I mean, I do not know, but yeah, a lot of studies already show that just mere exposure of money can enhance your pain tolerance. So, yeah, let me end this session by thanking him. Thank you so much.
Wow, with that thought, I would like to thank Professor Alan Harvey and Professor Rashmi for this wonderful fire chat. Thank you so much. That concludes the session and also the Q&A session. I'm sure a lot of you still have some questions. You can find Professor Harvey in the backstage. Ask him your questions. And I just want to take a moment to thank you for the lovely audience that you have been today. I know you are all waiting for the concluding session of the day, which is going to be hosted by, he needs no introduction, Ranvijay Singh. I know you're all very excited. I will request you all to sit tight for just 5 minutes. We'll be starting very soon with this session, the best of unbounded science. Thank you.